Hello, and thank you for allowing me to speak as well to the organisers. So I work in social care in the voluntary sector in Edinburgh, and I'm also a Unite Health and Safety rep. So people talk about the crisis in care. It's been a crisis for years, since long before COVID. I'm going to tell you that it's an emergency now. Recruitment and retention is the worst I've seen it in over 2 decades in the sector. We've got incredibly high sickness absence and we're hemorrhaging staff, whilst privacy agencies extract huge profits, hundreds of thousands of pounds of public money for each voluntary sector or council provider to plug the gaps in staffing essential services. The quality of support inevitably suffers, provided to people who need it to live decent lives. Stress is a health and safety issue, and our members are truly at or past breaking point. We need union reps to say this loud and clear. The system is beyond broken. Across services, already burnt out staff dedicated to the people they care for are bearing the brunt as new people join and quickly leave, recognising the onerous roles often carried out as lone workers. This past year, staff in my own workplace have been working multiple consecutive shifts in the homes of people that they support because there's literally no one to relieve them. Like the NHS, social care has long run on their now threadbare goodwill. With the huge responsibilities care workers have for the safety of people deemed vulnerable and the low value attached in society to the actually highly skilled work it involves, many have chosen to move elsewhere where pay and conditions are the same or better with considerably lighter duties. And now we're in a cost of greed crisis. When nurses are reliant on food banks, you can be sure that care workers are. There's little to keep workers with us. Accessing training or supervision now feels like an unaffordable luxury. Staffing and financial shortfalls mean a greater temptation to place workers without the necessary training and experience in services with complex challenges, increasing the risk of harms to people we support and to staff. A social care worker with over 5 years of experience will earn on average just 6 pence more per hour than a social care worker on their first day in the job. Even managers and senior staff are paid very small amounts more than new to sector people. And as other sectors walk out on strike, we're still on tenterhooks as to whether the Scottish Government will pay out a measly 3.8% wage increase to direct support staff. Not only has health and safety within social care been massively neglected by successive governments, I suggest it has largely been a neglected topic within trade unions before now. And I think partly that's because of low unionisation within an often isolated care workforce, but partly because it's kept going by largely female workers, with a high proportion of migrant, Black and ethnic minority staff. It's also as if the stigma associated with disability and frailty and the people we support extends to the staff working with them. People switch off when we talk about social care. And yet all of us are likely to depend upon care at some point. It's both our collective responsibility and in our best interest to ensure that services are sustainable and humane. This emergency concerns us all. Government and society supposedly woke up to the pressures on the sector during the lockdowns, so let's talk about COVID. We all know the shameful consequences of government policy to discharge COVID positive patients into homes in the first waves of the outbreak, where many care staff had to watch helplessly whilst people they cared for died in huge numbers. My own colleagues in the community felt the sheer terror that they could unwittingly carry COVID from one disabled person to the next. Not only that, it's estimated that over 1,000 social care workers died across the UK during the pandemic, most likely as a consequence of their exposure at work to coronavirus. Over 1,000. And that's not to mention the large numbers with complex healthcare needs as a result of long COVID contracted in the course of their work. Care staff were going out there daily, working long hours in people's homes, which are often far from the clinically clean and well-ventilated environments of the NHS. The nation clapped for carers, yet on the ground we saw our essential PPE diverted to health services. The NHS needed it, of course, but the politicians and public understand the vital importance of the NHS, whilst historically there's been very little public understanding or acknowledgement of the vital importance of social care and how the NHS literally can't function without it. The work that we do keeps people from ending up in crisis, in hospital, in need of other overstretched services. The trauma of that time meant many committed and experienced but exhausted staff had simply had enough. Good care relies upon consistency of support, and that is seriously threatened. This current crisis of recruitment has shone a light on other risks that we care workers have long experienced, but which have long been dismissed as just part of the job. Aspects of our roles involving working alone with those displaying so-called challenging behaviour as a consequence of distress. This means vicarious trauma and supporting people with mental health difficulties that are exacerbated by the uncertainties of COVID and increasingly precarious finances. This at a time when members' own mental health is already suffering. But it also means, of course, social care staff being regularly physically hurt in the course of their work. In my own career, I've been hit at, spat at, punched, attacked with a knife, and sexually harassed. Because people we care for are not always able to cope with their feelings without our support. These issues have almost not been widely discussed before because of good intentions to protect those viewed as vulnerable. The outcome is greater risk of harm for us and those we support. Likewise, the issue of sexual safety of female staff in particular has been ignored. Social care workers are frequently subject to sexual harassment or assault in the course of their work, but it's an issue shrouded in secrecy. There are sometimes tensions between the needs of those we support and the risks presented to staff, which often feel sidelined by employers. For example, between the right of individuals to smoke in their own homes and the high levels of exposure to second and third-hand smoke for staff working there. Social care employers can often have woefully poor understanding of their health and safety responsibilities to their staff. It's sometimes literally back-breaking work in difficult environments with long unsocial hours. It occurs to me as well that the majority of my colleagues are also part of that army of unpaid carers, juggling their work in the sector with responsibilities towards elderly and sick parents or disabled children, and without whom the entire health and social care system would have already collapsed. In the social care sector, the isolation of the workforce means it's hard to unionise or build a sense of worker power. Staff often don't feel a sense of agency over their jobs. The huge issue of funding and the low esteem in which care workers held by society are fundamental to the problems we face. Health and safety is a critical issue right now. The support of unions and wider public understanding of the pressures care workers face are needed more than ever.